Welcome! Today, we're going to dive into a therapy that's getting a lot of buzz for tackling that really stubborn muscle pain, dry needling. Let's get right into what it is and how it might be able to help you.
You know that nagging knot in your shoulder? Or maybe that constant tension in your back that just will not let go, no matter what you do? Yeah, it's a super common and honestly a super frustrating problem. With all the different treatments out there, it can be really tough to figure out what's what. So we're here to cut through the noise and give you a really clear, straightforward look at dry needling so you can figure out if it's a path worth exploring for you.
Okay, so first things first, what in the world is dry needling? Well, before we can understand the treatment, we got to understand what it's actually targeting.
The target is something called a myofascial trigger point. I know, that's a mouthful, but it's just the official term for those tight, angry little knots in your muscles. You know the ones. They can cause pain right where they are, or sometimes they even send pain to a totally different part of your body.
And dry needling is the procedure designed to deal with those trigger points. A trained provider takes a super thin, sterile needle and inserts it directly into that spot. The most important word here is dry. Absolutely nothing gets injected. This technique is all based on modern anatomy and how our nervous system works, which is what makes it different from traditional acupuncture.
The whole process is kind of like hitting a reset button for your muscles. First, your provider will find that exact trigger point causing all the trouble. Then, they place the needle, and this causes a really brief, involuntary muscle twitch. That twitch, that is the key. It's what helps the muscle finally release all that built-up tension, which in turn improves blood flow and helps you heal.
Now, for certain situations, the technique can get a little bit of an upgrade. There's an advanced option that actually adds a small electrical current into the mix.
So let's compare them side by side. Standard dry needling, it's all about the needle itself creating that twitch. But when you add what's called E-stim, it creates a more steady, sustained muscle contraction. So what's the benefit? Well, it might help reduce that soreness you feel after treatment and give you an even stronger reset effect.
So, this all sounds interesting, but the big question is, what does the science say? It's really important to look at the whole picture here, what patients are saying, but also what the broader medical community thinks.
If you talk to patients and practitioners, you'll hear about some amazing benefits. Really fast pain relief, getting your flexibility back, and having a powerful, drug-free way to deal with everything from chronic headaches to sciatica. The evidence is pretty solid for short-term pain relief, say for up to about 3 months. It's also really clear that it works best when it's part of a bigger plan, combined with things like exercise. With all of that on the table, we get to the most important question. Could this actually be the right choice for your specific situation? Let's take a look at the conditions it's most commonly used for. Dry needling is used for a whole range of muscle and joint issues. We're talking everything from that classic neck and shoulder tension to low back pain, sciatica, and even things like plantar fasciitis in your foot. So if your pain is coming from one of these areas, it might be an option worth talking about.
Of course, we have to talk about safety. Now, a big study found that about 19% of treatments had some kind of adverse event. And you might hear that and think, whoa, that sounds risky. But it's so important to understand what that number actually means.
Because the vast majority of those events were super mild and temporary. We're talking about things like a little bit of bruising, maybe a drop of blood, or some soreness. Pretty much exactly like how you'd feel after a really good workout. When it's done by a trained professional, serious side effects are incredibly rare.
All right, so you've got all this information. Where do you go from here? Let's talk about how you can take this and make a really empowered choice for yourself.
This right here is probably the most important takeaway. Dry needling is not a magic bullet. Think of it more like a really powerful tool in a bigger toolbox. The best, most lasting results almost always happen when it's combined with other things, like corrective exercises, to fix the root cause of the problem.
So the real question now is, are you ready to have a real, informed conversation about your pain and what your options are?
And the best, safest first step you can possibly take is to book a consultation. Go talk to a licensed, certified professional who can actually assess your situation and help you figure out if dry needling is the right tool to add to your recovery plan.